wouldn't buy a damn, dryer from a company like that who won't stand behind their product. I mean, it's unbelievable.
Well, a couple of statements I want to make before we continue. First of all, that came from about a 25-minute recording. That was about 8 minutes of that. I like to, I know other news programs, you would probably just get 30 seconds that we'd all move on. I think it's really important that we sort of hear the culture of what's going on. It's clear in that conversation, there's one of three people that care about the interests of the patients the way we would want them to, we expect them to, and others that are saying things like, you've got to toe the company line. It really is what the health system wants, not what we want to do. I mean, these types of the discussions happening. I also want to make it clear, because so many of you out there are whistleblowers. Many of you are already talking to us, but if you're interested in being a whistleblower, all you have to do is go to whistleblower@thehighwire.com. Send us an email. It's totally private. I'm sorry, whistleblower@icandecide.org. Whistleblower@icandecide.org. We will begin a private conversation with you. As I've said, we've had many of those conversations going. Very few decide to come in front of the camera, and we will never discuss that until you do. I also want to make it clear that if you are one of these people that is inside of a hospital system, that phone call was recorded in New York, right? Correct?
Correct.
Which is a one-party state. What that means is it's legal to record a phone call without the other party knowing. You may not live in a one-party state. If you live in a two-party state where both sides need to know they're being recorded, we would never want you to break the law. So be very careful before you decide to do what Deb did here. Make sure that you know the laws of your state and that it's legal for you to record or videotape the conversations that you are having. And then once you have those, though, and you've done it legally, please reach out to us and we will discuss what you can do with those. Okay, so with all of that being said, I want to get back to this incredible conversation. Clearly, they're upset with you. You sent out an email saying we should be very aware of this thrombocytopenia. We could kill people. This is very important. But they're like, you really should have talked to us first. And like I said, when she's saying we need a consistent message, and we're really trying to promote the vaccine, we don't want vaccine hesitancy. We're trying to get over that. And you're kind of starting to sound like you're anti-vaccine, and we can't have that. Was that the response? When that phone call, when you got, I'm sure like you get the call, we'd like to have a conversation with you. Did you think this was coming?
I knew that after I sent out that, actually, I shouldn't say that. When I sent out that email, again, I thought I was doing the right thing. Yeah. I'm like, these are people I've worked with for a very long time. They respect me highly. I really didn't think I would get that response. And then I did. Like, that's when everything kind of changed. And, yeah. And I was like, I don't understand. I just don't understand. Right. Why. It's about the patient. That's what this is about. That's our job.
It's amazing. You keep hearing these statements that, the science tells us it's safe and effective. And you're sitting here thinking, I don't trust the science anymore because we're the ones that are supposed to be reporting this. And you're literally being told, stop reporting for anyone else in the hospital. No one else is. So you're going to represent, what, one out of how many doctors that's reporting in your hospital?
There's quite a few.
How many?
There's quite a few. I mean, if you think about the ER doctors, the hospitalist doctors, even the surgeons would see some cases. I mean, maybe 20 doctors, but then there's PAs too,
right?
That are seeing things or could be seeing things that would be reporting.
So one out of 20.
I mean, the clinics too, the outpatient clinics.
So we're just going to try and take some math out of what's happening in this one hospital. We're seeing about 1 out of 20 of the amount of cases that could be being seen in this hospital. And so far, how many cases do you think you sort of reported to VAERS?
I kind of lost track at 120. I have quite a few still that I need to report, and it's just such a daunting task. I've been so busy. It's really hard to do. And again, keeping in mind, again, the far majority of those are now only my patients, and again, they're not all at all. And I know it doesn't sound like a lot, but I'm in a small hospital system.
And so not only this phone call, we've got some emails that they sent to you. They're a little bit annoyed. Let's take a look at one or two of these emails. Per our discussion, moving forward, you will only report, they obviously want to get this through to you. They want to make sure you heard, only report adverse events you encounter on your patients. If another provider sends you patient information, requests you to file a report, you will advise them they need to complete the report with VAERS.